Hello, everyone. Thank you for participating in the 2020 STAR TIDES virtual demonstration, which focuses on sustainable resilience. My name is Lieutenant Colonel Chelsea Payne, and I appreciate having the opportunity to speak with you today. I am a preventive medicine and family medicine physician and the Public Health Emergency Officer at United States Africa Command, known as AFRICOM. I work with Colonel Jonathan Craig Taylor, AFRICOM's command surgeon, who will also be speaking later during this event. Today, I'm going to speak with you about water, sanitation, and hygiene in the context of the COVID-19 pandemic. The content of this presentation does not represent the views of the United States Air Force, Headquarters, USFRICOM, the U.S. Department of Defense, or the U.S. government, and I have no relevant financial interest to disclose. Here's an outline of what we're going to talk about today. First, I'll discuss COVID-19 transmission and water, sanitation, hygiene, and waste management. Next, I'll talk about COVID-19 on the continent of Africa, as well as secondary effects of the COVID-19 pandemic, which include food insecurity and pandemic risk. Finally, I'll discuss the Sustainable Development Goals. So, COVID-19 is caused by the SARS-CoV-2 virus. And this outbreak started in Wuhan, China, with initially a pneumonia outbreak that has since spread around the globe. The main routes of transmission are through person-to-person contact and respiratory droplets. The virus can survive on common surfaces as well for a limited period of time. And really, survival time depends on numerous factors: the concentration of virus, humidity, temperature, as well as what the surface is. Here you can see studies have shown shorter survival on surfaces such as cardboard or fabric, with about 3-day survival on plastic and steel, and longer survival on wood, copper, and glass surfaces. Fortunately, this virus can also be inactivated quickly with common cleaning products and disinfection practices. Frequent hand washing is important, along with common respiratory etiquette, including covering coughs and sneezes. People who feel ill should seek medical advice and self-isolate to avoid exposing others. For those who work in healthcare settings, there are additional considerations to include hazardous waste and postmortem management. Numerous studies have looked at the SARS-CoV virus in the environment, and the World Health Organization, as well as the U.S. Centers for Disease Control and Prevention, have indicated that there's no evidence of the virus persisting in drinking water. There is also no evidence of it persisting in groundwater. There was one study in Italy where coronavirus was found in the river during the peak of an outbreak, but that appeared to be related to contamination from raw sewage. Human coronaviruses are sensitive to conventional centralized water treatment. This includes the use of UV light and chlorination. Distribution systems should maintain a residual concentration of chlorine throughout the system. In addition, the WHO has identified several best practices, which include protecting the source water, treating water at point of distribution, ensuring safe storage of treated water. And then for households that do not have piped water, there are other options, which may include boiling, ultrafiltration, or solar irradiation of the water. Now, I'd like to touch for a moment on some special scenarios related to water and COVID-19. So the care of COVID-19 patients at home should be done in a very careful manner. The first thing to remember is whenever you have other individuals who are not infected but are at risk and at home with the isolated individual, physical distancing is important as well as the wear of masks. There should be avoidance of sharing kitchen utensils, cutlery, and crockery. And if possible, the infected individual should have a private bathroom and a private bedroom. If a private bathroom is not possible, then shared bathrooms should be disinfected daily, and frequently touched surfaces should be cleaned regularly. For waste, such as tissues or soiled clothing, that should be placed in sealed bags and disposed of with general waste. Also, in the context of water, I'd like to mention public pools and beaches. The risk of SARS-CoV-2 transmission through fecal contamination has been deemed low by the World Health Organization. For pools, standard hydraulics and conventional filtration systems should offer adequate protection, along with residual chlorine levels. If residual chlorine levels drop, they could be augmented by UV or ozone disinfection procedures. One recognized risk in, for example, indoor pools is crowded spaces. So changing rooms, showers, kiosks, all of those are higher risk areas for people to come into close contact. So administrative controls such as advanced registration, limiting the number of people in spaces, as well as environmental controls such as changing the layouts of the physical environment can all be used to help mitigate risk. So in reference to wastewater treatment, it's important to note that the SARS-CoV virus RNA fragments have been detected in wastewater. The virus, though, is generally believed to be rapidly inactivated in the human colon. The virus is also inactivated through usual sewage treatment processes. And the risk of transmission from a fecal-oral pathway appears to be low. But it's still important to recognize that a risk exists, particularly for caretakers of COVID-19 patients, healthcare workers, and sanitation workers. Sanitation workers perform essential functions. They need to have appropriate personal protective equipment, as well as worker training in the use of that equipment, cleaning it, and the handling of hazardous waste. Interestingly, sewage surveillance may also have added roles in addressing the pandemic. Sewage surveillance has been used in public health for many years to monitor things like poliovirus circulation, as well as antibiotic resistance. There have been many studies in the US and abroad that look at sewage surveillance as part of a coronavirus warning system. The University of Arizona began collecting wastewater samples from dorms when their campus reopened and demonstrated the ability to identify and isolate an affected dorm and to then identify 2 students who are asymptomatic and prevent an outbreak. Now, numerous nations, including the Netherlands, Australia, and New Zealand, are using sewage surveillance as part of national monitoring systems. Here you can see the Netherlands approach. They have a dashboard that identifies multiple metrics used in their early warning system. So they monitor the average number of virus particles in the sewage system at 300 different sites. And they use that information as well as surveillance information from primary care clinics who report the number of new patients who are presenting with COVID-19 symptoms. I'd like to shift now to looking at the continent of Africa. This has been an important question. Why is there lower morbidity and mortality from COVID-19 on the continent? Here, you can see the case fatality rate of COVID-19 during the pandemic. This data is from Johns Hopkins, and you can see that the case fatality rate, which is the ratio between confirmed deaths and confirmed cases, has been about 2.4% in Africa. And it's been higher in Europe as well as the US. A preliminary analysis shows that more than 80% of Africans in several African countries who were infected with the virus were actually asymptomatic. And this is compared to an estimated 40 to 50% of individuals in the rest of the world. This article was published in the American Journal of Tropical Medicine and Hygiene, and it identifies several factors that are likely contributing to this lower case fatality rate. First, population age is important because we know that older individuals are at increased risk for severe COVID-19 infection complications. And in Africa, the populations in general tend to be more youthful, and thus they are more asymptomatic or have mild symptoms. Median age is important in the population. For instance, in Nigeria, it is estimated to be 18 years, and in Italy, it's approximately 46 years. Lower population density is probably also contributing. More people live in rural communities across Africa. Baseline immunity is theorized to be important. It's possible that prior exposure to other coronaviruses due to contact between bats, livestock, and humans in rural Africa may have resulted in pre-existing immunity. There also appears to be less cases in Africa due to low baseline volume of travel initially in the outbreak and the closure of several main transportation routes. Finally, mitigation measures were put into place early, movement restrictions and social distancing to limit spread of the virus. There are numerous countries that have also dealt with the Ebola crisis and have learned from those experiences and put practices into place quickly. Now, there have been many secondary effects of the COVID-19 pandemic. Economic impacts, the restriction of movement across the globe, disruption of education systems, and changes in societal norms. Also, supply chains and logistics that provide essential items have been disrupted. The continent of Africa is particularly at risk due to baseline, in many areas, political instability, conflict, other infectious diseases, and limited public health services. All of those things can contribute to a large humanitarian crisis. I'd also like to highlight that from the United Nations Global Humanitarian Response Plan, there's a relationship between food security and pandemic risk. You can see here that on the x-axis, as the epidemic risk index increases for a country, so does the food security index. So higher risk areas have higher risk of food insecurity. And also on this graph, the size of the salmon circles show you the top 10 largest appeals for international aid. Of note, Somalia and South Sudan are in the top corner. Finally, I'd like to close by pointing out that the Sustainable Development Goals are very relevant and also very at risk for being impacted by this pandemic. Goal 6 calls for nations to ensure availability and sustainable management of water and sanitation for all people. Goal 3 calls for good health and a focus on health for all populations. It's important that we continue to work towards the Sustainable Development Goals, and by doing so, we also help populations to respond to the epidemic and to protect themselves from acquiring the virus. If we are to meet the Sustainable Development Goals, just like if we are to address the pandemic, it's something that no nation can do in isolation. We certainly have to work together. So in summary, today we discussed COVID-19 transmission, which is primarily through aerosol particles as well as close contact. We talked about water, sanitation, hygiene, and waste management practices, which are very important to preventing SARS-CoV-2 transmission. We went over how COVID-19 is impacting Africa, including some secondary effects such as food insecurity. And we closed with the Sustainable Development Goals. And of note, Goals 3 and 6 specifically call on nations to address good health and water. These are references for this presentation. And I'd like to say thank you to you for participating in Stars, Tides and listening to this presentation. Have an excellent day.